When lifting, especially a deadlift, we want to make sure that beyond just tightness in the hamstring, you don't have tightness in your sciatic nerve or maybe an underlying disc-related problem that would cause that to get very much irritated if you did this movement and had those issues underlying in your legs. So this is a test that you're going to try to make sure that if you do have hamstring tightness, that's okay. If you have sciatic nerve tightness, the deadlift is probably not something that you want to work on right away. And there are different variations that we'll talk about you can do. So a test to do for yourself is something called the Slump test or a neural tension test. So to do that, I prefer sitting. Now if I'm sitting on the floor, I can do both feet at the same time. If I want to bias one at a time, I may go to like dropping off my leg off the edge of a couch or a bench or my bed. So this will be to test my right leg. So as I sit up here, as I bend forward, I want to go to where I feel some tension in the back of my leg or anywhere, right? And I'm going to let myself kind of round my shoulders and sit with this slouched, not so good posture. And I'll get to a point where I say I feel some tightness. I pull my toe up, yeah, it feels really tight. Now the key is going to be, does the head position change the symptom? So as I take my chin to my chest, I might say, oh, that pulls. And if I keep my back and everything else in the same position, I just lift my head, does that change it? So the change in head position pulls at my spinal cord, which is not impacting my hamstring or any muscles, but just impacting my nervous system. So if the head position, this is tighter, and this feels better, that is a positive neural tension side, and I'm going to want to be careful with the deadlift because putting too much pressure on my sciatic nerve is going to result in some not so good things happening. So another option to test both sides at the same time would be my feet out straight if I was sitting on the floor, and I can do the same thing, kind of rounding at my back, slouched posture, toes up, and I come down to a spot where I feel tightness or a little discomfort, and then everything stays the same except my head. Does the head position change the symptom? If it does, once again, you're going to be very careful with the deadlift because that's a sign that your nerve is either being impinged or is tight. If you do something to continue to put a stretch on that nerve, nerves don't respond like muscle and where they like to be stretched. Nerves, when they're overstretched, become irritated and painful. So it's a good screening test prior to going through the deadlift, and we'll talk about some interventions that you can possibly do to correct that.